The Alzheimer's Society of Toronto is taking to the front lines to find new treatments for Alzheimer's. Yesterday, CEO Cathy Barrick used a new technology developed in Canada called the Spartan Cube to determine if she was at risk. The small but portable cube cuts waiting time for results to just 1 hour. Joining me now in studio are Cathy Barrick and Medical Director of the Toronto Memory Program, Dr. Sharon Cohen. Good morning to both of you. This is so important. Dr. Cohen, you've got the little cube with you, which really looks like a little speaker or something.
Yeah, 4 by 4 inches.
And tell us what that does.
So this is a research device developed by, as you said, Spartan Bioscience in Ottawa, yay, Canada. It analyzes DNA from cells in a cheek swab. So we do a cheek swab, don't need a blood test, no invasive test. Put the specimen in. So I brought along a cheek swab. You would stroke the cheek, inside of the cheek, put the specimen into a cartridge here, put it in the machine, okay? And then in an hour, you get a readout on a computer attached. And what you get is specifically a readout of a risk factor gene called ApoE. And ApoE is important in Alzheimer's disease because people who have a particular type of ApoE, called ApoE4, are at higher risk of Alzheimer's disease. This gene isn't powerful enough to determine that you will absolutely get Alzheimer's disease.
Which is an important
That's very important
point to make.
But individuals are often interested in knowing their risk. 2 copies of E4 puts people at substantial risk, maybe 10-fold higher risk.
Okay, and we'll get to why that is significant in just a second.
Sure.
But Cathy, you and I go back. You are one brave lady. Because a lot of people wouldn't want to know. Why was it important for you to know?
I'd say 2 reasons. I'm a curious person, so maybe that's number 1. But number 2 is to make better health choices. So I would rather know if I'm at risk of something so I can make good choices, go to the gym more often, eat healthy, things like that. But probably the biggest reason I wanted to know was if I could help in research. So if I did have the risk gene, and I have the results here, if I did have it, then perhaps I could participate in a prevention study.
Do you want to share?
I do.
Okay.
So I don't have it.
You
so
don't.
I have, so this is my result. So it's just like Sharon said, within an hour, the results popped out and this is it. So I'm E3, which means I don't have the E4. It doesn't mean I'm not at risk, though. I have the same risk as probably the rest of the population does. The E4 is really just one that is specific, just increases your risk if you carry it, but everyone's at risk. So we all need to be careful and, you know, take action to prevent things. But I would have liked to have been able to participate in a prevention study.
So, Dr. Cohen, if someone does, in fact, have the gene, if the results, do I call them positive? Is that the way that you would phrase it?
We would say if someone's an E4 carrier.
E4
1
carrier.
or 2 copies, yes.
What does that mean for them? Because as you say, it doesn't necessarily mean you're going to get it, but what does that mean for them moving forward?
Well, we are now in the era of prevention studies for Alzheimer's disease. So the burden of getting rid of this darn disease doesn't fall just on the frail, elderly, compromised individual who's struggling with symptoms of Alzheimer's disease. The burden falls on all of us, and especially those of us who are getting a little older, 60 years and above. There are prevention studies, and in peeling off the layers of risk, one risk group are people, cognitively healthy people, like you and I'm older than you, so I'll put myself in the 60-plus group, who may carry 1 or 2 copies of E4. So that doesn't mean I have Alzheimer's disease, but I'm at higher risk to get it. And we know the process that goes on in the brain that causes one to develop Alzheimer's disease, or at least instigates the disease, is accumulation of amyloid plaque. That starts 10 or 20 years before we have Alzheimer's disease.
10 or 20 years.
So now, if we can find people who are at risk and do something while they're healthy, and there are studies now with interventions, some of these are lifestyle interventions, but there are medications now to lower plaque in people who are at risk for developing more plaque, or who already have plaque accumulating but are still healthy, working, shopping, banking, you know, anchoring a TV show. Not to make it too personal. Being a medical doctor, let's turn it on myself. And this is fantastic. And so we can all do something to move the cure forward.
Final question, because I'm just about out of time. Is this available to people? Can they go and take this test? If they're curious, what do they do?
I think they would call the Toronto Memory Program. I mean, it is, at the moment, it's not a diagnostic test. It's
Correct.
really associated with research. So if someone was curious and wanted to go on a registry, if there's a research program available, I think you call Toronto Memory Program and get your cheek swab. It was easy.
Okay, getting back to your earlier comment, let's get rid of this, please.
Yeah.
Yes, thank you.
Yes.
Yes.
Okay, I thank you both. Cathy Barrick, Dr. Sharon Cohen, great of you to be here with us today. We'll be right back after a quick break. Don't go away.